As a joint replacement specialist, I often get the question, what is the difference between a partial knee replacement and a total knee replacement, and which one am I as a patient a candidate for? When you look at the knee is divided into three different compartments. The inside part, which is referred to the medial part of the knee, the outside part, which is referred to as the lateral part, and then the patellofemoral, which is behind the kneecap. In some folks, the disease, arthritis, is localized into one compartment. In that situation, you can have a partial knee replacement, which just replaces the affected compartment of the knee. A total knee replacement replaces all three with metal replacements of the femur and the tibia, the thigh bone, and the shin bone. The meniscus, or the cartilage cushion in between, is replaced with a highly molded piece of polyethylene. My advice to patients is not to dwell on which procedure they would like to have, as opposed to which procedure will treat their symptoms the best. If your arthritis is confined to one compartment, then the partial knee replacement will treat you well and will get rid of your symptoms. However, if you have diffuse symptoms, a total knee replacement is the answer for you. Both of these procedures provide the final result, which is a replacement of your arthritis. The long-term results of both are the same.